Hello, everyone. My name is Melissa Pearson, and I am the project coordinator with Fredla. We want to welcome everyone to the third webinar in our Learning Exchange series titled Parent Support Certification, National and State Options. In a moment, Sandra Spencer, the Executive Director of the National Federation of Families for Children's Mental Health, will provide an introduction and the context around the topic of certification. This webinar is being provided in partnership by the Family-Run Executive Director Leadership Association and the National Federation of Families for Children's Mental Health. Both of our organizations are partners within the TA network, the Technical Assistance Network for Children's Behavioral Health. As you can see from our slide, there are numerous partners that make up the network and provide technical assistance and support to the SAMHSA-funded system of care sites. This webinar is going to initially provide information about the certification movement and the National Certification Initiative. In the second half of the webinar, we are going to share some data gathered by a recent survey of the current state of certification across the country. We will also highlight two state-specific certification models. So I hope you will stay tuned for the full session because we have a lot of great information to share with all of you. And now I'm going to turn it over to Sandra Spencer to get us started.
Good afternoon, everyone, and welcome to the webinar. The role of family support has been around for many decades. It was a natural role for parents as it became clear that children with mental health challenges were being treated in multiple systems that were not integrated. Parents had to go to multiple agencies and act as their own case manager of sorts in order to get the services they needed. For example, mental health providers didn't necessarily work with schools or special education programs, and pediatricians hardly ever spoke to psychiatrists, although they both may have been prescribing medications to the same child. Child welfare, we know, works in its own silo, and even within child welfare, sometimes a family who may have been receiving housing or food subsidies may not even be coordinating with the person in Child Protective Services. So, if a child even became involved in juvenile justice, this sometimes provided an interruption in all of their services, and they didn't even get any integrations with school in that case. So parents learn through trial and error how to navigate multiple systems, and they served as their own nucleus for getting agencies to communicate with each other. So, from this challenge, a lot of parents, through their lived experience, really decided that they didn't want any other parent to have to go through what they went through. So family members began to take the role of helping other family members navigate these systems and to learn what their rights and roles were. And so this soon became known as parent support and the role of the parent support provider. It has had several titles over the years. It has had several functions over the years and several different and multiple job descriptions. But what we realized that there was no formal training, there was no formal supervision models, and sometimes the roles varied from state to state and even sometimes varied from community to community. So both families and child-serving professionals started to have the conversation about the need to validate this role. And in validating this role, we thought about what it would look like if this was a more professional role, and professional in the sense that this would become a billable service, that families and caregivers could get paid for their role in offering support. So what you're going to hear in this webinar is why parent support is so valuable, and what do we mean by parent support provider certification. You're going to hear the option of national certification and that of state certification. And as Melissa said, you're going to hear some examples from 2 states. You're also going to hear some recent data that gives you an idea of the value of this role and what's happening in many states across the country. So let's get started. I'm going to introduce you now to Linda Gargan, who is a Senior Managing Director here at the National Federation of Families.
Good afternoon, everyone. This is Linda Gargan, and I'm so happy to be with you. Let's get into our slides and begin looking at the role of the parent support provider. And here's the first question that we typically hear. What is a parent support provider? Sandra just gave you some wonderful examples, and you see in front of you the written definition that we utilize for parent support providers. As Sandra said, there are multiple titles for this service across the country. And this service is provided formally and informally, as we will discuss. But for us, the most important part about this is the lived experience. And what is the lived experience? That is the experience of having been actively involved in raising a child who experiences emotional, developmental, behavioral, substance abuse, or mental health challenges. This is a pivotal point for us in our definition of parent support providers. These are the people who do have this experience of navigating the system. And these are the people who have received specialized training, and this is a distinction that we will be making as we go through these slides. For parent support providers, as we are speaking about them in certification, it's critical that they have received some specialized training regarding assisting and empowering other families. Now, Sandra's going to give you a couple of real examples about the role of the parent support provider.
So on a personal note, over 20 years ago, as I was trying to navigate the system for a 4-year-old who was being placed outside of my home and put in residential treatment facilities, as a young parent, I had no idea where to turn. But I was several parents in my community who had had some experiences, and they kind of told me what they did and gave me examples. But the real support came later on as I found out that there was an organization called the National Federation of Families for Children's Mental Health, and I was able to call the national office. And at the national office, there were parents who had many years of experience raising their children, dealing with multiple systems. They knew the IDEA laws around special education, and they were able to give me concrete examples, tell me who I should contact in my school district and what I should do. So there's a different role in that friendship where somebody just kind of giving you advice, and a role of somebody who can be a parent support provider.
So as we talk about this is clearly what we are striving for, is to know that there are parent supports that can be formal or informal, or there may be a combination, as Sandra just spoke about. Let's look at the differences. Informal support, typically a volunteer role. This is more of a supportive get-together, a listening ear. It's that person that you depend on when you can't come up with the answers for things. It may be your best friend. It may be other people you've met at PTA meetings who have similar situations going on with their children. This is a very laid-back, informal way of receiving very important support. Now, obviously, these folks may or may not have received any specialized training, and here's our distinction. For formal support, these are typically paid. We look more at structured support groups. These are people who may attend medical appointments or educational meetings with a family, and they are there for a purpose. They are there to help with understanding, interpreting, advocating. They have very specific roles. And they also provide extraordinary linkages to resources. And these individuals have received specialized training, and they are receiving supervision.
And I'd like to stress again that both roles are important. as family navigate systems, as family try to get services and support, that informal role can be a life changer as well. A friend, an extended family member, someone in your community to go with you to IEP meetings and things like that is critically important. But then also a trained parent support provider, someone who has had some education, some training, and that lived experience can really be a critical component as well. So we hope that you get the distinction and that you understand that we are saying that both of these are really important, and you'll understand why as we move further through the presentation.
So let's look at some of the characteristics of effective parent support providers. This is a very short list. This list could go on for several slides, but we wanted to just look at a few things here that are very important. To be effective in family and parent support, you must have effective listening skills. You must be able to listen rather than being ready to talk. You must be able to be an active listener. You also will need to be collaborative because, as most of us know, navigating systems requires incredible collaborative effort, and that's one of the really important characteristics for a parent support provider. Adaptable is critical. It's very important that you are able to adapt to different situations and to not lose your cool when that happens. Non-judgmental. I do believe every family I have ever spoken with this has been a huge thing that we've all talked about. So we all share this. Please don't judge us. Please work with us, but do not judge our families or our actions. Clearly, you need to be resourceful. You must be respectful of all family practices. Confidentiality is a must, and this is truly a legal and ethical issue. And then very important, you need to be a positive problem solver. We can clearly identify the problems. What we're looking for is the resolution. So again, these are several of the characteristics that we find most effective in parent support. The list is much, much longer, as you can imagine. But these are some of our top ones. Here are two important principles that we try to embed in parent support provider services. One, experience is not universal. Just because you have lived experience, because you have raised a child and you have lived experience, that does not always prepare the parent support provider for the experiences of other families. So to be effective in this role, we believe that you must understand that every family is unique. And there are culture, beliefs, and experiences of families that must be respected.
And as all of you may know, the cultural piece and the respect is a huge issue among families. So families come in all kinds of makeups, and we have to be respectful of that. I would like to give you another personal example. When my son was about 8 years old, we received an in-home support provider who would come to the house to meet with me and to work with us around, services we could ask for and how to navigate the system. This person had a very different religious background than my own. And as they were in our home, they would continue to talk to me about what they believed spiritually and how that if I would practice some of their beliefs, things would be better. And that's one of the things that we really talk about in the points that Linda made, that you have to be respectful. Some things are ethical, and some things we have to learn as parent support providers to do, not to do, and to say and not to say. So when you go to take your training, that's an important element. We want to make sure that people who are nationally certified have these qualifications to work with unique cultures, to understand beliefs and experiences of families and to respect them at all times.
The next principle that we are very strongly wedded to is the principle that the family's role changes as their children transition into adulthood. For all of us on the phone who have raised a child, we do know that one of the things they do is they grow up. So we go from this child system into the adult system. The family is always there, but the systems change. So it's very important that the parent support provider can evolve with this family and can begin to adapt to a new role as this child grows up and as the family is getting closer to launching this child into adulthood. Now let's look at a little history about the Parent Support Provider Initiative. I've got some dates up here for you that are very important. These are milestones for us here at the Federation. You can see that in 2007, a lot of this work started, and then there was a little gap into 2010 where competencies were established, the job task analysis was completed, and in 2012, we launched our pilot certification exam. But I'm going to have Sandra give you some of the real history behind this.
So as I started in my introduction, the role of parent support has been around for decades. And we know that a lot of the chapters across the country of the Federation of Families have been doing parent support within their state. So in 2006, the National Federation held a focus group at a national conference, and there were about 50 to 60 family members at this focus group. Among those family members were executive director of family-run organizations, key family contacts who were associated with systems of care funded communities, and families who were currently receiving services in the system. And at this focus group meeting, the National Federation announced that it was going to launch a national certification that would certify parents to be parent-to-parent peer support providers. At that meeting, there was mixed feelings in the room. As a matter of fact, it became quite the debate. The main issue, the main conundrum was a lot of families felt like they did not want to professionalize the role of being parent support providers. They felt like the lived experience was enough and that we would be changing the whole role of what parents did naturally. There were also some executive directors in the room who ran statewide and local family organizations, and they did not want to become provider organizations, meaning if they started to train and hire parent support providers, they would have to go through the process of being Medicaid billable or able to take payments from health insurance companies. And they were not sure at the time if it was a wise thing for them to become a provider organization and somehow shift a little bit in their role as advocates and policymakers within their state. So it took a while for the Federation to really take this step. So that's why in 2007, we started to collect data, do job test analysis, and we continued over the years to question the field, to have focus groups, to really get everybody's buy-in before we launched in 2012 with our pilot certification program.
Well, along with this, again, we come to what is the eligibility criteria. After all of that pre-work was done, there had to be some decisions made. And again, as we've mentioned earlier, we will continue to stress our most critical eligibility criteria continues to be the lived experience. That is what we believe makes peer support, whether it is adult, family, youth, whatever type of peer support it is that's being offered, there must be lived experience. Now, with this lived experience, it's important to remember that everyone's lived experience is different. My lived experience is different from Sandra's. For everyone on this call today, those of you who do have this experience, each of us have a unique experience that we bring to the table. It's very important that we do not try to categorize or judge one another's experience. The experiences that each of us have had in raising children who do experience challenges and who have had to navigate systems, each of our experiences is just as valuable as that of the next person. Within the certification, we have 11 domains of competence. And as you look at these domains, you will see that these are things that we have been talking about throughout this presentation. These competencies parallel very closely to state certification competencies. As we've researched this and looked across the states, while we may use different names, there may be a bit of difference between our domains. These 11, for the most part, are the ones that we do agree are very important. We've talked about ethics, we've talked about confidentiality, we've talked about affecting change. Obviously, you must know something about behavioral health if you're going to be effective, because it's very important that you know what you're helping people to support. The education system is critical. Being able to communicate, being able to help others to parent for resiliency is very important. Obviously, advocacy and empowerment go hand in hand. And with that, wellness and natural support. How often do we meet families who are not taking care of themselves? We are there to help them with that and to help them to identify their natural supports in their community. As we all know, not everything has to be paid for, and those natural supports are a huge piece of sustainability. Now, local resources are local resources. What's important in these domains is that our parent support providers know how to research and locate local resources in their community. Here's some additional eligibility criteria, and this is where we get into distinguishing certified parent support providers from those very valuable family support providers who are volunteering and doing this in a more informal way. There is a requirement for a significant amount of training across the domain. There is a requirement for 1,000 hours of experience, but please pay attention. This can be paid or unpaid. This is where we want to stress the value of that volunteer work that so many people have done. There is an agreement to abide by the Code of Ethics, and then obviously individuals need to pass the national examination. Here's our current status of parent support providers. As of this week, I actually updated this slide because we've had several new people certified just in the last few weeks. We have 189 individuals who currently are holding national certification. Now we have been doing this now for about 2 years, so we feel pretty good about these numbers. Even more impressive is the fact that 35 states in the District of Columbia are all utilizing nationally certified parent support providers. Here's some ideas of how parent support providers are embedded in the mental health system, and this would be true across a variety of systems. We've been able to utilize them within schools, within clinics, on mobile crisis teams. Parent support providers have been invaluable. In intensive in-home services, this is such a wonderful addition to an intensive in-home team, because as these folks are going into the family's home, it is so comforting to have someone there who has been through typical experiences just like you have. And then within the court system, and many court counselors and judges believe that this has been a very valuable addition to their system as it helps them to better link with the family. What are our current challenges? And there are several. We have challenges with our reimbursement mechanism. We are working very, very closely with a number of states because as of now, peer support services are included in Medicaid state plans for 32 states. But many of these, while they're part of the rehab option, have only covered adults as of now. Now, as many of you know, in May of 2013, there was an informational bulletin that came out from CMS and SAMHSA, and it confirmed the inclusion of families and youth in the definition of peer. Just like so many things that come from the federal government down to the state level, this is taking a bit of time for states to absorb and to work into their state plans. But we're very hopeful that we will see more and more states including family support as a part of their peer services. So here's some data that was collected recently. We had a pool of about 435 individuals, and we asked questions. And we asked how states are utilizing Medicaid funds. Are you doing that? As you can see, we had a pretty close split. And I apologize that the percentages are a little bit difficult to see on this. But we had about a 50-50 split. Now this slide is a little busier. It shows current funding sources as reported by those 435 individuals. As you can see, grant funding continues to be a major piece of the funding that's being utilized. We're seeing some private insurance. We still have some volunteer work going on, but grant funding is still our major provider of funding for this service. Here are some additional challenges. Certification requirements. Medicaid requires that there be a certification process in place if peer support services are reimbursed. Now, states are scrambling. There are some states that have put very sophisticated certification processes in place for adults. But many of those states have not yet created a certification process for families. And this is critical. There is the tension between creating and adapting a model. Adult peer support is different than family peer support. There are differences that need to be included in the certification process. It's going to be very important that all states address these differences as they develop their models. So here is where we got our data about whether or not your state has a certification or training for parent support. And you can see that a large number of the participants had both certification and training. This is very encouraging to see. Other states, there are still about 25% of the people who were polled did not have any type of certification and training. So there's still much work to be done. And finally, the last challenges that I want to speak about, the challenges of reciprocity. We have an emerging workforce here, and this workforce is nationwide. And for this to be viable, our parent support providers need to have a mobile credential that allows them, no matter where they live and no matter what organization they're affiliated with, that their certification is reciprocal with wherever they happen to move to. It's essential that the state and national certifications develop reciprocal agreements. And this is a real point of work for us. Our goal is to see more and more states begin to do this. And then my last point would be research. This is an emerging practice, and we do need outcomes. We need to be able to prove the fidelity of these services. There is a huge need to continue to measure and validate this service. As this happens, as the research emerges, as we are able to prove that these services are working as well as we believe they are, then we should find that we have much, much more success working with states on moving forward in this direction. And now I'll turn this back to Melissa.
Thank you, Linda. For the next half hour or so, we're going to focus on some of the key issues surrounding certification of parent peer support providers. In our work with family-run organizations, the topic of parent peer support, training of the parent peer support providers, and certification are frequently issues that come up. So this webinar is a timely opportunity for us to offer support to all of you. As Sandra and Linda said, family-run organizations have provided parent peer support to families for decades. However, over the past few years, there has been a movement to formalize this support service. As a result, many family-run organizations and states across the country have or are in the process of developing state-specific certification models for the family members with lived experience who will provide these important resources to families. We will share with you some information we have gathered in a recent survey regarding statewide family-run organizations and their efforts around certification. Additionally, you will hear from Rhode Island and New York State about how they have built their certification and credentialing models. So let's get started. In preparation for this webinar, Fredla developed a survey to collect information about what types of certification efforts were underway across the country. The survey, sent out to statewide family-run organizations, asked them to indicate if they had a certification effort in their state, and if so, what their model included and how many family members were certified. What we learned from this survey was quite interesting. Of the 42 individuals who opened the survey, 39 provided responses to some or all of the survey questions. Of the 39 respondents, about 25 completed the majority of the questions. This was in part because of different organizations being in different places of development with their certification efforts. The first thing we learned was that while there are a handful of organizations who have a fully developed and implemented certification model, the majority are currently in the developmental stages of creating their certification models. The second thing we learned was that family-run organizations are struggling with numerous issues impacting implementation, including such things as evaluation tools, continuing education, and ongoing support and supervision. 31 states indicated they already have a model developed or are in the process of developing one. Of the 31, 25 of those indicated they are or plan to utilize a state-based model. Many of the states we spoke with have indicated that their models have components to them that would align with the core competencies of the National Certification Initiative, thus allowing for the parent peer support provider to seek national certification if they choose. We asked states responding to the survey if their state used a separate certification model for adults and parents. We learned that over 25% of states use the same model for adult peer support providers and parent peer support providers. While we recognize that there are some core competencies that would be similar across the peer support providers, there are distinct and unique differences to parent peer support services. Thus, Fredla hopes that whatever decisions states make regarding the certification model they implement, that there will be training, support, and supervision to the parent peer providers that recognizes the continuum of care needs that is unique to families whose children and youth experience behavioral health care disorders. We asked organizations next to indicate who provided the training of parent support providers in their state. What we learned was that the family-run organization is a training entity in 62% of the states responding, as well as other nonprofits, universities, and state agencies. Comments left regarding this question indicated that in some states, because their model was not yet finalized, training had been developed to meet the need, but that as they finalized their model, the current trainings may or may not be included. Another area of emphasis, as Linda and Sandra both explained, is around the requirement for lived experience. When we asked organizations if lived experience was required to be a certified parent peer support provider, we found that all but one organization indicated that lived experience was a requirement in their certification model. However, when individuals commented on this area, there were concerns expressed that the requirement was difficult to enforce. This is another area of particular focus for states when creating a model. Mechanisms must be developed as to how to assess an individual's lived experience to ensure that those providing parent-peer support are peers and can connect with the families they serve from a place of lived experience. Next, we asked organizations how many hours of training they required to obtain certification. 70% of the states responded that currently they have certification models that require over 40 hours of training. However, 80% of those states had no minimum number of hours spent providing parent-peer support prior to the individual seeking certification. Of those who did have a minimum number of hours required, the hours ranged from 100 to 1,000 hours. This is another area that many respondents indicated they were struggling with, in part because some states wanted to certify parent support providers to get them on the ground providing services and have a minimum number of hours for individuals to maintain certification. When we asked organizations if a written exam was required to become certified, approximately half of the states responded that they were currently utilizing a written exam as part of the process to obtain certification. Those who do use an exam do so in a variety of ways, including hard copy, in person, online, and as part of a more comprehensive assessment process, including an oral panel interview. In attempts to try to assess the cost for parent-peer support providers to obtain certification, we asked organizations about their certification fee. 65% of them indicated that there was currently no cost. Of the 35% who do charge a fee, 60% indicated that they charge more than $200. In most cases, however, the state was the most common source of payment of that fee. Another interesting piece of information obtained through the survey was related to employment of parent-peer support providers. 91% of the organizations responding indicated that agencies and organizations other than the family-run organization employed parent-peer support providers. That does not mean that family-run organizations are not employing or providing parent-peer support. However, it is another area needing particular attention. While it is good to have broad capacity to ensure families have access to this needed support service, it is important to ensure that family-run organizations are integrated into the certification model to ensure integrity of lived experience and fidelity to the support. I am now going to hand off the presentation to Lisa Conlon-Lewis. She is currently the Interim Director of the Parent Support Network in Rhode Island and is going to share with us how they developed their certification initiative. After she has finished, Ann Kuppinger will present about how Families Together in New York State developed a credentialing initiative. Once both of them have finished, we will discuss a few of the areas we believe are crucial to a successful certification effort. Then we will have time for question and answers from all of you. Thank you.
Thank you, Melissa. This is Lisa Conlon-Lewis, and as I get into the Rhode Island certification model, as Melissa had said, everybody's on this developmental road, so I would say our certification model I would say we're still in the early developmental stage, and we have now had it up and going just about a year. So, and it took us a while to get to that point of having it operational. So Parent Support Network in Rhode Island, as the statewide family-run organization in partnership with our Department of Children, Youth, and Families, which in Rhode Island, that state agency represents child welfare, juvenile justice, and children's behavioral health as one department. So we worked with our state agency and also the Child Welfare Institute at Rhode Island College, which really is the pre-service in-service arm of the Department of Children, Youth, and Families. So together we worked on developing the statewide family support partner training and certification. This is a model that's also built around wraparound and our overall Rhode Island WRAP training and certification model. The family support partner serves as a peer mentor with the primary role of empowering the family towards self-efficacy, as the wraparound model has at its core. And they're really integrated in partnering on the child and family team process, developing the individualized care plan. Because we're working with families who may be involved in child welfare for abuse, neglect, or a voluntary due to high-end behavioral health or probation, we're working with families with very different backgrounds. Sometimes the child need is the major source and be the defined person of population and bringing the family into the WRAP process. But sometimes because we are working also with a child welfare population of maybe even being charged with abuse and neglect, we may be having the parent as a very primary focus. And together we're really working with that family to build the voice and choice. And we do a lot more parental protective capacity work and really looking at how do we build those areas that might have been seen as risk or safety needs into becoming really strong parents. The family support partner definition I have put here, I'm not going to read through it, is very similar to the definition that the Federation was sharing at the beginning of our certification. I think what we have found is how important making sure we stay true to that definition. And again, as Melissa was sharing, that both family organizations and agencies are hiring a parent peer support provider workforce. And in our state, our family-run organization as Parent Support Network are hiring an array of peer support positions, but so are the agencies for this family support partner position. The family support partner positions really are working very broadly, and we're really trying to hire families who represent. And when we're using the family, we're trying to get to that day-to-day caregiver, and we're always trying to hold that integrity. Next slide, please. So our training and certification model, again, sitting on top of a full WRAP training, we're doing, as it pertains to the family support partners, 2 days of intensive face-to-face training that is required not only by family leaders who have been hired as family support partners, but also our care coordinators or /WRAP facilitators, and also the supervisors of both of these positions. So that 2-day training is taking place as integrated to the full WRAP requirements, and then also they are required to complete a number of other trainings that include safety and risk, understanding the system of care and follow-through, visual diagnosis, understanding the juvenile justice system. There's many. This is domestic violence. Also, I can get a full list of this out to everybody, but this is approximately about another 100 hours of training. The certification requirement is to be completed within 1 year. Beyond the direct face-to-face training of all these different modules, the next step is also beginning to demonstrate competencies through observing, and this is where the family support partner supervisors, both internal to the family-run organization and all the agencies across the state, are starting to watch and observe family support partners in their work to ensure they're getting to the core competencies and skill sets. And as they start to do that work, then they're passing those observations. Next slide, please. Here are, on the next slide, as you're seeing, here are a list of all those different trainings that I was talking about. Most of these are anywhere from a half-day training to a full-day training. Also tied to each of these are continuing education credits, and it's been nice to have both the DCYF social workers, the care coordinators, the family support partners all really cross-trained together, and so there's a lot of opportunity for learning and getting these supports as we're doing the training and really building good team and collaboration because they're doing all this together integrated. Next slide, please. In regards to the 2-day training focus that's on site, these are the main training objectives where we're trying to help everybody get an increased understanding of the role in how it presents within the wraparound service delivery model. We're introducing all the core competencies and skill sets. We're doing some behavioral rehearsals and work to really get everybody feeling comfortable. We're focusing in on family scenarios that can help us to build on protective factors and strategies for building those protective capacities. If any of you are working real closely with child welfare, under the Child Family Service Review at the national level, there is that drive to really do family-centered assessment around protective capacity. That gets done usually well, but the piece that is harder that I think our family support partners have taken a lot of leadership in and based on their training to be able to do better is they're really then taking those areas that may have seen as high risk or needing help and support to then really bring the support of helping families to understand that. Again, sometimes these could be perceived as mandated areas families need to work on, sometimes even for reunification with their children. To increase the knowledge of strategies for engaging families, really the direct service roles that our family support partners are doing, so we're giving them some added skills and learning around doing parent education, looking at it from a positive youth development. We talk a lot about dealing with trauma and crisis. I used to be a proponent, especially in my many years of teaching our peer mentor program with a more informal training done under the family organization, not a state credentialed program. But we used to be very flexible that families could call your phone after hours, different times. And what we learned as we took on more intensive populations of families in need, that we had to gear and teach and support a lot more around crisis intervention and to draw on our partners and to have clearer boundaries, in, especially as we needed that crisis support, and how to best communicate with our families in the times around that. And that continues to be an area of a lot of ongoing training. And again, I think another real important objective is how much we're really working together to really increase the partnership between these core positions, the family support partner, a DCYF social worker who's still responsible going before family court every day and having a legal obligation to a care plan under wraparound, and our network coordinators and the overall team. So during this whole training and certification process, these teams are getting stronger and that learning is taking place. Very important for everybody to be integrated together. Next slide, please. Here are all the different topics that are being covered beyond those objectives, right at a deeper level. So these are the core curriculum areas that we're getting into. I think, again, pointing out that this model is built around wraparound, which really is our service delivery model statewide. And so this is why we're really building the family support partner model within that. Also at Parent Support Network, we have peer mentors who do tend to go through this training also, but they're working with families sometimes before they get engaged in the RAP process and definitely after as they transition. So we're doing and teaching a lot around those types of family support and even how families are getting connected to peer mentors as they need to. Next slide, please. Here are the actual areas of competency, and then each has about 10 to 12 skill sets underneath them. So again, very much matching to the wraparound process, but again, foundation to the work that we are doing in our lived experiences. Right from the beginning, we know our family support partners have to be really comfortable as it's appropriate and relevant to be able to tell and share their story. This is usually a big deciding factor for an individual based on their lived experience, whether they're really ready to become a family support partner and their comfortability with sharing some of their lived experiences as it's appropriate and relevant to the family. The second competency is around family engagement and really building the relationship to get the family. We find our family support and our partners are brought in many times when that engagement has been hard to engage, and very quickly we're able to get the full team and core partners, even such as the care coordinators or the DCYF workers who have struggled with that engagement, we're able to bridge and bring it back together. And then team engagement is really about where working with families, they're always going to be sitting on different teams like their RAP team, and how do they begin to feel comfortable and what goes into that and the relationship and how to pull those different team members together. We believe strongly in natural supports, and I'll show you a snapshot of that. The family team meeting action steps, really important, especially around certification. We are really starting to be very clear how we can make and ensure that if the care plan is the document that really becomes the document that moves Medicaid reimbursement, that our direct services as family support partners are really defined within that, and our work and our action steps, so it can all be tied back to a goal and an action step that then becomes Medicaid reimbursable. And this is a piece we're really working hard on right now. Same with documentation, and that how our staff are learning to really do the documentation is in alignment with good practice, but also able to ensure that we're going to be ready and be able to do Medicaid reimbursement. Next slide, please. This is just a snapshot of, here you have the competency of natural supports. In prior training, we may have looked at natural supports as a segment of the overall care plan when we're at our child and family team meeting, and in what we've learned through our observations and really starting to work on these competencies is this becomes a meeting in itself. And usually the family support partner is the best person to really take the lead. This also connects directly with culture, as has been shared in this workshop, and taking really into a whole, hour and a half, a really discussion around these areas of skills to really feel confident and being able, and we have found that as we have moved this piece of the certification, we've seen a high increase in the natural supports that are there. Next slide, please. These are just some outcomes. So now that we're seeing family support partners, we actually went the first 4 years of the family support partner being rolled out without the certification in place. Now the certification's been in place for a year, and as you can see, where you have a family support partner, there is a better, team agrees that RAP goals were met, so family support partners showing that we're doing better and helping to achieve those goals with the family. That if you were unable to connect with the family, you see that was much higher if a family support partner was not involved, and if a family support partner was involved, that went down. So there's, just a few areas, and we're just starting to get this type of data, and we do have a family evaluator that's continuing to do this, matched with some questions of the family support partner role, so that we can continue to track this area. Next slide, please. So, to bring this to the next level, we are excited that, it's starting to take place under the wraparound, but we also know we have many different roles of parent support providers, both under our family support organizations and with other partner family support organizations in our state. We have teamed up with the Rhode Island Peer Support Workforce Initiative, which is being really led through our Department of Health, and they were able to receive through the National Technical Assistance through Maternal and Child Health. They chose for their National Technical Assistance Initiative work to focus on this role and bring the state agency partners along with us as the family support organizations to really look at all our different roles of peer parent support, be able to look at the curriculums we're all doing, the different competencies in court, including the family support partner certification and training. So we're really crosswalking all of that now. Not only are we crosswalking it with state curriculum and competencies that we're all doing, but we also want to build upon the national standards and the national certification models as shared already earlier, how important that is, that we'll want to keep those alignments going together. And of course, we're also all working on how to expand the Medicaid reimbursement. So our goal is by December 2015, with this certification work group, that we'll really be moving this together in partnership with our state agencies and family support organizations. Next slide, please. And finally, some of our lessons learned. We are seeing the family support partner outcomes with families, really seeing that become better as we get increased skills and confidence of the family support partner workforce. We see engagement increasing, definitely much better clarity between the role of family support partners, care coordinators, their supervisors. It used to be where family support partners would feel like maybe they were working for their care coordinators and tasked by them, to now they're teaming and their partners, and they have defined roles working together with the family. We've learned a lot around safety and crisis plans and how to respond within crisis. We're also excited because we'll have a mobile crisis team coming on during the summer months, which we think will really help and support the partnership, because usually families, the first person they'll call, even if there's a formal system in place, is their family support partner, because that's who they engage and trust is. Another reason why we really had to step our certification and training up in those areas. We have really been able to build a good partnership as a family support organization with clinical supervision. So within one of our major network providers delivering wraparound, we're actually doing a co-supervision model. So we have family support partner who's credentialed and certified, who's serving as a supervisor, but then clinical supervisors too, and they're co-supervising all the staff together, both family support partner and care coordinators, and that's been some great cross-learning together. This is also, as we're starting to get more outcomes, it's helping us to increase our ability to say and justify the need to increase the number of family support partners overall available to families. And then again, as we're learning, we're also looking at how to expand this certification model to all our parent and youth peer support roles, as I had just discussed with the other work group. And as we've worked on our state definition of parent peer or family peer support, we made sure that our definition was inclusive of the youth peer support position. So as we keep moving towards Medicaid, we won't leave that valuable role out of the equation as we work towards that. Next slide, please. And finally, some recommendations as you're working on this. Partner definitely with your state agencies or county-based agencies. Definitely work with recognized credentialing institutes. It has moved us a lot, partnering with a state-level college and the Child Welfare Institute. Don't start from scratch. Research all the effective training curriculum and standards that exist both in our states and nationally through the Federation. Offer ongoing peer support provider training and leadership development opportunities. So I had mentioned we do our statewide peer mentor training. That's definitely a family support organization certification training, not a state certification. But again, it gives a lot of the prerequisites of this workforce, and many of the family leaders went through those trainings before they took on to this next level of this workforce position. And actually, some of those opportunities of going to those trainings really readied them to become part of the family support partner workforce. And finally, evaluate your outcomes of your parent peer support model. So you're going to need this information to keep reflecting on how to deepen and strengthen your competencies and skill sets, and to justify, like in the outcome information I showed you, why we're making a difference, and we should be able to justify our expansion of hiring more peer support providers. So from here, I will turn it over to Ann from Families Together of New York.
Hi, everybody. This is Ann Cuppinger, and I work at Families Together in New York State, and we are the statewide family organization. And we are not actually providers of family peer support services, but we work in concert with a number of organizations around the state that are providing family support services. But that's the difference between our approach in all of this and some of the other organizations that are actually also service providers. So we are the credentialing agency in New York State, and we've launched this initiative, which has been, we've been credentialing advocates for about 3 years. But we've launched it with a lot of support from the New York State Office of Mental Health, and that's been a really important partnership. We also have some really strong academic partners who initially were at Columbia University, and now that whole group of folks have moved to New York University. And they've been very instrumental in providing a lot of resources along the way. The training that is, I'm not going to talk a lot in my presentation about the details of our training. It's quite similar in terms of the competencies and the topics that are covered to what Lisa just described, and also to national certification training requirements. But what we noticed in New York State many years ago was that we were plugging family advocates into trainings that were really designed with other roles in mind, and that we didn't really have a training that was specifically for family advocates. So a group of people got together and included academics, clinicians, family advocates, and parents to develop a training that was specifically designed with the role of a family advocate in mind, and we call it the Parent Empowerment Program Training. And that training continues to evolve as our understanding of the competencies and the environment in which our advocates are working changes. So if people want more information on the training, I'm happy to provide that for you. So those academic partners were kind of spearheaded the initial training development effort, and Families Together and our team of wonderful trainers around the state have continued to evolve that training over the past 10 years or so. So we have family peer support services in New York State in all different kinds of settings. We don't have a common program model or a common fiscal model. It grew up fairly organically in each different kind of environment. We don't really have wraparound operating statewide, although we do have some counties that use a wraparound model, and they have done wraparound training and family partner training in conjunction with the wraparound training. We have family advocates working in waiver programs, in freestanding community-based family support programs, in clinics, in hospitals, in lots and lots of different kinds of settings. We have recently actually put pen to paper to articulate a shared definition of family support, and it was pretty interesting how relatively easy that was, because we've been moving along together in a conversation about what is family support, what is the unique role of family advocates in the system, how's that different than other professionals that are working with kids and families. And the reason that we really felt like we needed to, get that down was because we need to go deeper in terms of how the service is understood by a wide range of people, and to help people really stick to allowing our family advocates to flourish in their own specific role rather than getting pulled off task based on whatever else isn't available in the system. We also are looking down the road to making family peer support a reimbursable service under Medicaid, and that definition was important for that process as well. That's something I can also share with people if they're interested in seeing that definition. We have about 400 family advocates in New York State. It's kind of an unofficial best guess. About 230 of those advocates are now credentialed through our process, we're quite pleased with that number, having only been in operation for about 3 years. I think we're going to see a significant increase in this next year as well, because the state is now actually requiring credentialing in a number of different kinds of programs. So if you're a new hire in our home and community-based services waiver program, state-operated inpatient programs, and residential programs, you have to be a credentialed family peer advocate. And it is part of the proposal that's going to be advanced to the Center for Medicaid Services that this credentialing would be the required credential for family peer advocates seeking reimbursement under Medicaid. We've had good participation from the very beginning, but even those people who were sort of hanging out, taking a wait-and-see approach, are starting to pay a little bit more attention now that they see that that it's something that's going to become a requirement. The funding for our family peer support services is largely grant funding, consistent with some of the findings of the survey that was talked about earlier. We do have programs that are contract providers through the waiver, so it's sort of indirect Medicaid funding for them. But we're about to head into Medicaid managed care for children in 2016, and with that, we're hoping that there will be additional revenue available for family peer support services. There are some challenges. That's the subject of another couple of webinars about Medicaid managed care and how to sustain family support in that environment. But we're trying to take a glass half full view of all of that. So these are the requirements for our credential in New York State. Somebody asked a question I saw in the question and answer section about whether or not family members whose kids have developmental disabilities would be included. In New York State, they are. So our definition is that you have to be the parent, and we define that broadly, or primary caregiver of a child or adolescent with a serious social, emotional, behavioral, mental health, or developmental disability with onset prior to the age of 18. So, the goal here is really to look for people who are peers to other parents and primary caregivers. And it's, no one really questioned that. I'm starting to get more and more questions about that as we move forward with the idea of Medicaid reimbursement. I think that, that people are trying to sort of see if they can redefine that. And we're really trying to have some conversations about why we feel it's really important to stick to this lived experience criteria as really being the heart and soul of what family peer support is all about. So you have to be an adult. You have to have a high school diploma or GED. We do have some exceptional cases, in particular people who were raised in other countries, who we allow to submit documentation from their supervisor that they have comparable skills to someone with a GED. And we still encourage people to go ahead and get that GED, but we didn't want it to be a barrier. You're required to complete the Parent Empowerment Program training, and there is a 3-year renewal of the credential, and as a part of that renewal process, you have to document 30 hours of continuing education. So far, we haven't specified particular continuing education requirements. You have to submit a lot of documentation that shows what kinds of courses you're taking, and we have to approve that they're appropriate for the role of a family peer advocate. But we're fairly flexible about what we allow people to do because we realize that people need different kinds of continuing education based on their role and their experience. Going forward, we will have some specific required continuing education modules that we ask people to do to fill in some of those competency areas that we think are important but not necessarily being addressed in a formal way. We require 1,000 hours of experience in the role of a family peer advocate. That's equivalent to 6 months full-time work or a year of half-time work. It can be aggregated for more than one job, and we do accept both paid and formal volunteer work. And by formal volunteer work, we just mean something that's significant enough and structured enough that you had some supervision and that someone can actually vouch for the fact that you were doing the work. So a typical volunteer kind of service that would be counted would be a family member who ran a support group for 5 years, twice a week on a volunteer basis for an agency. Or maybe it was a family member who served on the Committee on Special Education as the parent rep. The application includes letters of recommendation from your supervisor and 2 other additional professional letters of recommendation. We have a code of ethics. You have to do a statement of lived experience and talk about how your lived experience, how you use that experience in your work with families. You submit a resume and a professional development plan. Those professional development plans have been helpful to us in seeing where people have strengths and, self-assess strengths and weaknesses to help us plan future training. So, we developed this credential really out of a many years conversation about the model and the competencies. There was, as Sandra mentioned, some ambivalence at first about going down this path because it formalized something that was really a very grassroots kind of service. I think people are comfortable with that now. They're still nervous about some of the restrictions that may come with Medicaid funding, but I think they appreciate the benefits of a statewide consistent training and credentialing process. I can't speak highly enough about the nice partnership between the state agency, the family-run organization, and our academic partners. That's been a really great partnership. And I think Lisa's absolutely right. Do not go out and reinvent the wheel. There are some really great things already happening, and some of the trainings that are appropriate for other professionals can also help family advocates as long as they're adapted. We really found that it was important in defining the requirements for the credential to strike a balance between making it something that was rigorous and meaningful, but also feasible, and feasible now, and feasible once billing becomes a pretty big force in the system. So that's a judgment call, and we're going to be adjusting that, I think, forever. I think this is a living and breathing process, and it will, if anybody thinks it's static, then we should talk, because really it's going to change all the time. So, for example, the first conversation said something like people need to have 3 years of full-time experience before they get credentialed. Whereupon one of our family support providers raised their hand and said, so when we're billing Medicaid and I can't bill until that person has 3 years of experience, you understand that I can't hire them because I can't afford to pay them. So there's chicken and egg issues here. And what we've tried to do, and we have a provisional process as well, is create an entry-level credential that meets kind of minimum requirements, and then we're going to be building upon that and also creating some advanced credential opportunities to strengthen the skill set that people have. And I think that what I really am pleased about here is that I think our family advocates as a profession are very committed to the growth of their profession and their skills, and they want to see that what they do is effective for families. So it's a very different conversation than it was 10 years ago when people were sort of, opposed to formalizing this and nervous about collecting data. I think everyone's really wanting to see that they're doing the best they can for families. So in terms of lessons learned, the quality and commitment of our family peer advocates is really impressive. I've read all 230 of those applications, and it's a real honor to be able to be allowed into the portfolios that just inspire confidence in the work that people are doing. I think it's really important to invest in conversations with all of the people that have anything to do with this to build consensus about the core competencies and the requirements for the credential. And that includes really thinking about all those people that you don't usually talk to, including, other professions. Social workers in New York have sometimes been a little nervous about the development of this credential. Talking to payers, talking to state agencies that haven't been as involved in the, the sort of family peer support movement. It's really, I keep telling people this is like the dating game. Just go out there and talk to anybody you can to start to continue to grow an understanding of what this is all about. Because even though we all know what this is all about and we really believe in it, it is very fragile. And so I think it's really important to not underestimate the courtship that's required to keep this going. In terms of actually launching a credentialing initiative, the time that you spend reviewing applications is really the tip of the iceberg of the work that you need to do this. Even if you're not doing training development, which we are, there is a lot of just cultivating and understanding and creating relationships work that's necessary. So it's a big job. And when you think about getting involved in it, I think think about the different steps that you take over a number of years to get to that place. The requirement, the state requiring this, really boosted participation for us. We didn't need participation. I mean, we had funding in order to do this, but we wanted participation for lots of different reasons. And we had an initial burst of applicants, and then we had a lot of wait and see going on, and now that's picking up again as it becomes a requirement. Sustainability of this is very tricky. I always tell the story about, if you're going to sell brownies, you go out there and figure out, what's the highest price you can charge for your brownies that people are willing to pay. Our family advocates do not earn a lot of money. The agencies that they work for frequently have, pretty slim budgets. Right now, the work that we're doing is still very much subsidized by the support that we get from the state. There's unpredictable demand. If we were depending entirely on the fees that we charge for credentialing, it would be very difficult to build a budget around that. So we haven't completely figured that out here in New York, but it is something for you to think about if you're thinking about getting into this. Other lessons learned, again, think through with your providers the implications of credentialing, especially when it's a requirement for any type of funding. Ramp up your communication around the family peer advocate competencies and their role and impact. I also have not put anything in here on the evaluation work that we're doing. We are using a number of different approaches to try to evaluate the work of family advocates, including the use of an instrument called the FANS, which is the Family Assessment of Needs and Strengths. And we're beginning to look at outcomes, and I'm excited that other people are too, because if we pool all of our outcomes, we'll be able to really understand better what works and to communicate the impact of family support. The turf issues, I talked a little bit about that. As family, you sort of see this happen as family peer support becomes better established and becomes potentially reimbursable service, and as we do a good job letting people know that folks are out there, and as payers, state agencies, and others start to say, wow, we really like what you guys are getting done, and it looks like a cost-effective service, other professionals, get a little edgy about that. And so I think it's really important to be talking about, the different contributions that different kinds of professionals make, and talk specifically about the contribution of family peer advocates and how it complements the work of others. Our training is co-led by clinical folks and family partners. And I really like Lisa's idea of the co-supervision not only of family advocates but of clinical people. I just think that's a really kind of a cool idea. And know that credentialing is credentialing, and that's important, but that along with it there are a lot of other things that you have to help your organizations, explore what are best practices for, like hiring, other training that they might do that's not required for credentialing. Supervision, that's an area that we're going to really be taking a look at over the next couple of years, and how you evaluate and hold folks accountable for the quality of the work that they're doing with families. And so with that, I think I'm going to turn it back over to Melissa or Sandra.
Thanks, Ann. Appreciate it. This is Melissa. We want to leave you with a few key areas for consideration as you move forward with certification of parent peer support providers. And Lisa and Ann did a really awesome job of outlining two different models, but both models being very well thought out and very with a very strong emphasis on quality and continuous quality improvement. As mentioned earlier, parent peer support is not the same as adult peer support. Therefore, we feel very strongly that parent peer support providers should have access to training that's different than adult peer support providers. The ever-changing needs of children and youth from birth to age 20 makes it crucial that the parent peer support providers be skilled and knowledgeable in an array of services, support systems, and resources. And that was clearly talked about throughout the webinar. We've learned a lot both through the survey and our interactions with numerous family-run organizations throughout the country that it is crucial for the family-run organization to work in partnership with the state agencies to develop, implement, and evaluate certification efforts. And Lisa and Ann both talked about some wonderful evaluation pieces that they're doing, and there's many across the country as well. They also highlighted really well that there are different roles for family-run organizations within certification efforts, and that can be as trainers, as providers of the service, as certification or credentialing bodies, or all of the above. But we really believe that the most successful certification initiatives around parent peer support have been those that have really integrated the family-run organizations in a meaningful and integrated way as the state moves forward with this developing this workforce. And continuous quality improvement is also needs to be a priority. Multiple feedback loops and routine review by the family-run organization, families, state partners, and parent support providers is crucial. Certification models are not created and then complete. What we've learned is that there is a need for them to be living, breathing initiatives that evolve as the needs of the providers and those they support evolve and can accommodate the ever-changing climates throughout the country and in states. It's also important that mechanisms are in place to ensure fidelity to the model, that parent peer support providers need to have lived experience raising a child and or youth with emotional, behavioral, mental, and or developmental disabilities, and that it's critical to preserve the integrity of parent peer support services as a family-driven, peer-delivered resource. The next slide, we've provided our contact information for Linda, Sandra, our Executive Director, Jane Walker at Fredla, and myself, Melissa Pearson. Feel free if you have any questions that we're not able to answer in the next few minutes to reach out to any of us if you'd like more information. And I'm now going to turn it over to Sandra Spencer, who's going to facilitate the question and answer portion of the rest of the webinar.
Thank you so much, Melissa, and thank you to all of the other presenters. If you have a question, there's the Q&A box, should be at the right of your computer. You can now type your questions in, and then we will go down and answer as many questions as possible. I would like to say, if you have questions and you put them in the Q&A box and we run out of time, we will respond to your questions via email. When you registered for the webinar, you provided an email address, so we will have a way to respond to your questions if we are not able to get to them. And first of all, I saw a couple of questions as soon as we got started asking if you all can have a copy of the PowerPoint presentation, and the answer to that is yes, in a couple of ways. This webinar has been recorded, and so we will be able to send you a link where you can not only have access to the PowerPoint, but you will be able to have the audio portion of the webinar as well. So we will make sure that we get all of these out to you guys. Okay, so I'm going to go and look at a couple of your questions. I see one question here that says, what is being measured and by whom in outcome gathering? So can any one of our two state representatives talk about in your evaluation what it is you're measuring and who's doing that data collection?
This is Ann. I can quickly give you a quick summary. We have a couple of research projects going on that are pretty focused. One is looking at the use of family support in the waiver. That's being conducted by our colleagues at New York University. We also have, and that's actually looking not so much at outcomes as it is at the process of, the organizational culture and how family support is or isn't able to flourish in different organizations, and what are the elements, what contributes to better integration of family support into a clinical model like the waiver. We also have the state does what's called the Family Assessment of Care Survey, which is more or less a satisfaction survey, and so family support questions have been recently added to that, and so we're getting some information back on both the utilization of family support and family satisfaction. And we also have this FANS tool, which for those of you who are familiar with CANS, which is the Child and Adolescent Needs and Strengths Survey, which is a tool developed by John Lyons, that is a clinical tool that's being used widely here in New York State, and so the FANS is actually a subset of CANS questions, and the way those FANS questions was selected was to look at questions that really pertain to the work of family support. So the questions focus on how the parent is doing and how the family is doing, as opposed to how the child is doing. So there's about 15 or 16 questions that were pulled out of the CANS. And we're now doing training across the state in the use of FANS, and they've been using it for some years in the western region of the state, and it has turned out to be a really effective tool, both to create a conversation between families and their family support providers, and also to track outcomes and help and supervision.
Thank you. So I also see a question that says, I'm sorry.
I was just going to share. I'm sorry. Go ahead, Chip.
I'm letting you go, Lisa, if you're going to answer that same question. Go ahead.
I was. So in Rhode Island, we have the WIFI Easy being done by the family members being served, so the Wraparound Fidelity Index, the easy version, through the National Wraparound Initiative. We also have 6 additional questions that focus all around the family support partner role, and this is done with families both who have the family support partner and who do not. And then you saw those other measures that were in the outcome area of overall service delivery questions. We think it's always important to be comparing both to those who do not have family support partners and who do, because you get those comparison outcomes. We are also using the Family Empowerment Scale through Portland State University, and we're doing that baseline and then 6 months out, and then continuing to do it incremental till discharge or transition of wraparound. And we also use it at the family organization overall, so sometimes we're watching that empowerment grow for quite a long time.
Thank you, Lisa. So the next question says, I've noticed that on your list of eligibility that you did not include parents that have children with developmental disabilities such as autism. Does this mean that you will not be able to certify a parent who has had experience yet her son only has autism diagnosis? So I know that on Ann's New York presentation, you addressed that you all did do that. And so, Linda, what about the national certification?
With the national certification, we absolutely include parents who have children who are experiencing autism. In fact, we have several families that have been certified as parent support providers whose children do have autism.
Lisa, what about Rhode Island?
Most definitely, and especially now with Asperger's being part of the DSM-5, I think we'll see that increase, but I'd say many of our families that they are both developmental disabilities and behavioral co-occurring.
Great. Thank you. So one other question says, what criteria is in place for recertification? Linda, what is happening on the national level?
At the national level, we're going to be coming up with our first group of individuals to be recertified. And our process, and I believe Ann mentioned the same thing, is going to be CEUs, or educational experience or training. So it's a much less rigid process than the initial certification. It is, the process at this point is demonstrating that you have continued your education.
Ann, Lisa, Melissa, anything to add?
In our state, we're just starting to have the discussion about what refresher would look like.
Okay.
This is Melissa,
Ann, I know you covered
and I
that.
think
Yeah.
one of the pieces, this was a piece that we got a lot of feedback on the survey from when we talked with family organizations, and this is definitely an area that I think a lot of states are trying to take a look at. Many of them are looking at doing very similar things to what the federation's indicated about continuing education areas, and a lot of them are debating whether they will set specific areas that people will need to get continuing ed in, or whether it will be general areas that folks will have a lot more flexibility and choice in.
The only thing I would add to that is that, you know, we had some very elaborate plans at one point and realized that we didn't really have the resources to implement them. So I'm sharing this just because I think it's important to, you know, look at what would be perhaps ideal and then look at what's realistic. And we didn't want to we wanted people to really continue their learning, and we wanted it to be relevant to the role that they were playing and related to certification. But we didn't want to create these hurdles that were difficult for our providers to really jump over. And I think over time we will be a little bit more structured about what we require in continuing education, but only when we're able to actually make sure those requirements are easily accessible, those courses are easily accessible to people, probably through web-based training.
Well, thank you so much. We are out of town, so let me remind everyone again that we have your questions, and we will answer your questions via email. And those of you who are on the webinar, we will make sure that all the questions and answers are posted so that everyone will have the benefit of answers. Please continue to put your questions on if you still have questions that you would like to ask any member of this webinar team, and we will make sure to get back with you. So I would like to take the time right now to thank all of you for joining us this afternoon on this webinar. We appreciate you being in attendance. I would like to thank all of the presenters, and I hope everybody have a good afternoon. We'll stay for a few minutes and wait for you to continue to load your questions. But thank you all for your participation.